Hi, Dr. Harsha. Excited to see you again. Welcome to yet another video. Thank you for your time and this opportunity. Please go ahead and introduce yourself.
Hello everyone, I am Dr. Harsha Yalgi. I am a consultant physiotherapist. I am based in Hubli, Karnataka. And today the topic of this video is back related problem, spine related problem.
Wonderful. Yeah, so the objective of this video is to help people with back issues and share advice from the expert or professional so that you can understand how physiotherapy can help you with back issues. Let's dive in. My first question is, please explain how the spinal cord is designed in simple terms.
Okay, in simple words, I'd like to tell that the spinal cord is divided in three major segments. That is the cervical area, the lumbar area, the thoracic area. Okay, the cervical area, then comes the thoracic area, and then comes the lumbar area, followed by tailbone. So cervical is from C1 to C7, thoracic is from T1 to T12, and lumbar is from L1 to L5. Basically, when I say lumbar, it is the vertebral body and the disc. Okay, so this is L3 vertebral body, this is L4 vertebral body, and this is L5 vertebral body. Then comes the intervertebral disc, that is the L3 disc, L4 disc, and L5 disc. This is the spinal cord, and the vertebral and the disc is just a support system for the spinal cord. So this is the typical design of a spine.
Got it. Thank you. The next question is, what is a disc bulge?
Okay, in simple terms, disc bulge is there is a compression of the disc, okay, and the impingement is on the spinal cord. So a patient with a disc bulge usually has low back pain and radiating pain in the lower limb. Either it is a left lower limb or a right lower limb. Sometimes it is bilateral lower limb radiating pain. Typically pain of low back pain and radiating pain in the leg. This is caused by disc bulge. There is a compression of the disc and there is impingement of the spinal cord. So in simple terms, this is the disc bulge.
Okay, that leads me to the third question, which is, how can physiotherapy help in the treatment of a disc bulge?
Very good question. Actually, more than anything, physiotherapy is the only thing which will help the patient to recover from chronic back condition, low back pain, disc bulge, sciatica, and all other low back problems. See, if a person is weighing somewhere around 100 kg, so the proportion is like 70% of the load is held by the muscles, okay, and only 30% of the load is on the disc and vertebral body, okay. So whenever the back muscles become weak or the person put on weight, then what happens? The muscles will not be able to hold the weight. The entire body weight is shifted on the vertebral body and disc, okay. Now the vertebral body is made up of bone, so it is strong, but the disc is like a shock absorber. Whenever there is a pressure on this, it will get compressed. This is the vertebral body, this is bone, and this is the disc, and this is the spinal cord. So if there is a compression here, see, the disc will get bulged and it will start hitting the nerve root. Okay. That is when the pain starts in the low back and radiating pain in the lower limb, okay. So if the body weight is transferred on this and the disc is not able to hold the weight, so it will get compressed. Okay. Then it will start hitting the nerve root.
Okay.
So what we do in physiotherapy to treat this condition is we will align the spine. The alignment of the spine is basically wrong. That is why there is a bulge sometime. Okay. Then we reduce the inflammation here. We treat the nerve pain, the radiating pain, we treat that. And then we strengthen these back muscles back to normal. Getting the point. So once we strengthen these back muscles back to normal, again, the body weight is proportion. 70% of the load is held by the muscles, and only 30% of the load is on the vertebral body and disc like before. Then the compression stops. See, when there is only 30% load on this, there is no bulge here. But when the load is more, it will get bulged and it will start hitting the nerve root. Okay. So basically, we offload this by strengthening these muscles.
Okay.
So this is a basic idea.
Got it. And now the next question is, why is a painkiller not effective on a back pain?
Okay. Basically, it is a symptomatic treatment. Okay. Now, what I mean by symptomatic treatment is there is a disc bulge here. Okay. And due to this bulge, there is pain in the back and radiating pain in the legs. Okay. Now, when you give analgesics, that is painkiller to treat this, what happens? The cause will remain the same. The bulge will remain the same, but the pain which is coming with this is subsided for that particular moment. Okay, till the effect of the painkiller is there. Once the painkiller effect is reduced, okay, the cause is still the same. So the pain will again start like before, or it will start more than before. Why? Because the cause is still the same, but only you have reduced it symptomatically. But once the effect of the painkiller comes down, your thing will be as usual. So that is why we have to treat such condition where the cause is reduced. When I treat the disc bulge and reduce the bulge, then it is treated correctly. We should not treat it only with symptomatic treatment. And of course, you have side effects as well. With painkillers, you will have a lot of kidney-related issues and liver-related issues, metabolic issues. So, and if the patient is diabetic, then the damage is more.
Got it. That leads me to the next question. That is back pain directly related to sciatica?
Typically, what I mean by radiating pain is the nerve pain. Sciatic nerve is a nerve in the thigh which gives the radiating pain. It is also due to some other reason also. Like for example, if there is a muscle called piriformis in the hip. So if the piriformis muscle shortening is there and compression is there, then also there is impingement of the sciatic nerve. That is, the sciatic nerve will get compressed with piriformis muscle, and then also a patient will start experiencing sciatic pain. So for thorough examination, a patient has to come down to the clinic and get examined whether he has a disc bulge or only sciatica. That will rule out only with few tests which can be done in the clinic, and also some MRI investigations.
Right. Okay. So a physiotherapist would be the best person to diagnose it.
Along with diagnostic tools like MRI, X-ray, and test, we can diagnose whether it is only a disc bulge or it is a piriformis syndrome which is causing sciatica.
Moving on to the last and the final question is, what are some of the do's and don'ts for back pain?
There are some activities which has to be avoided when there is a severe back pain. For example, forward bending is to be avoided. Why? Because when a person does forward bending, there is more impingement in the disc. If there is a forward bending position, the disc will become like this and the bulge will be more. So try to avoid forward bending, and if anything heavy has to be taken in this manner, a person can squat down and take. So this is the topmost priority thing when a patient is having a back pain, they have to avoid is forward bending. Apart from that, back extension strengthening exercise can be done. For that, we have a separate YouTube video, wherein we have shown the exercise, what a patient should do while having a back pain. And also that video has do's and don'ts.
With that, I hope our viewers understand how to treat back pain and the do's and don'ts if they have a back pain. So would you like to share any final advice as to how we can avoid experiencing back pain in the first place?
Okay, maintain body weight, do regular exercise, don't lift heavy after 45 years if you're not used to doing it. Okay, and whenever you're in gym, take a proper advice from the instructor. Use a lumbar belt while doing exercise, and also during bad roads, if you're above 45, 50 in bad roads, especially in conditions like in Indian roads, you should use a lumbar belt while traveling, because you never know when you get a bad road when you're on a high speed.
Yeah.
And keep yourself active. Avoid unhealthy food. Keep your weight under check. Yeah, those are the simple things you should do to avoid back pain.
Wow, I'm sure this will be helpful because a lot of us suffer back pain. I personally know many of my friends who are suffering from sciatica and back pain. So thank you so much, Dr. Harsha, for sharing your advice. With this, we will be ending the video. And if you thought this video was helpful, please like, share, and subscribe to my channel as well as Dr. Harsha's channel. It's called Sanmati Physiotherapy. The link to his channel is in my description box. You just have to scroll down and you'll find the link in the description. Thank you.
Thank you so much.
Bye.
Thank you so much.